Hi everyone. Today I'm going to be talking about joint problems in climbers, and one joint problem that is consistently presenting in rock climbers of all varieties, crack climbers, sport climbers and boulderers, is synovitis, which usually affects these middle joints here in our fingers, and it often presents the morning after. If you've got kind of stiff fingers, you need to loosen them up. Or if you've got discomfort in one of your joints, when you go to grab something like grab a mug of tea or grab something like that, if you get some discomfort or sharp pain in the joint, then it may well be synovitis. And if it looks swelled as well, sort of slightly larger than usual, then that could also be a sign of it. Synovitis is basically an inflammation in the joint, and it's an inflammation of the synovial membrane. So I'll draw that for you now. So grossly looking at the anatomy of the finger, you have two bones, obviously. So I'll draw this bone here. This is the proximal flange, okay? And this is the middle flange, okay? And obviously where they interface here is the joint, and they're covered, the face of these bones is covered in a layer of cartilage, which we all know, okay? And the cartilage is there just to sort of protect the bones if they sort of interface, okay? So if they were ever to sort of meet and squish together, then it's not bone grinding against bone, which would be, very painful and not good at all. So the cartilage acts as kind of a cushion, okay, and a shock absorber, okay? If you imagine your knee, okay, your foot is always pounding on the ground, which transfers to your knee. And if it was just kind of bone, bang, bang, bang all the time, you wouldn't be able to walk by the time you're sort of 10 years old. Now there's something else going on here. This joint is actually encapsulated by another sheath of tissue. And this sheath of tissue is called the synovial membrane. That's the bit that gets inflamed. That's what we're talking about here. So, and it basically forms this capsule. It's called the synovial capsule, funnily enough. And you can think of this like the skin of a water balloon, okay, surrounding the joint, keeping it as a separate package away from all the fatty tissues and the tendons and everything else that's going on in the finger. And this synovial membrane acts as kind of a protective barrier, okay, and inside here, inside the joint is filled with synovial fluid, okay. That's why you can think of it like the skin of a water balloon, because it's retaining all this fluid here. And because this cartilage is known as avascular, meaning it doesn't have any blood vessels in it, it's the job of the synovial fluid here to keep nutrients, sort of diffusing into that cartilage so it can repair itself. So the synovial membrane here is what gets inflamed, and it's not difficult to see why, okay? If we're sort of crimping like that, crimping on the desk, okay, we're sort of doing this. Sometimes we put our full body weight on these crimps, which kind of medically, biologically speaking, is a horrendous position for your fingers to be in. If we're sort of jamming our fingers in cracks like that and torquing it, okay, sort of finger jamming, we're putting a lot of strain, mechanical strain on this middle joint here, and this little synovial membrane is getting tugged and pinched in lots of different directions. I mean, look at that. As I'm crimping my finger, you can see it's getting sort of stretched here and sort of pinched here, and it's just, I don't know, it's a very, very tough job that this membrane has to do. Now, obviously, it's designed to take some abuse, and in fact, the whole purpose of this little capsule here, aside from nourishing the cartilage, is to actually absorb pressure and absorb shock, okay? Now I know that I said that the cartilage does that as well, but essentially this little fluid-filled sac here acts as kind of a shock absorber. And again, if we think about the knee, okay, your foot is constantly pounding the ground, okay, so we can think of this as our knee joint now. So our foot is constantly pounding the ground, okay. Now if it was just cartilage, okay, well the cartilage would act as a cushion for our bones, but the cartilage would wear out fairly quickly because it's constantly sort of being pounded on like that. So instead, we also have these little synovial capsules here to act and absorb that shock and take that pressure. And in the same function, our fingers, all of our flanges, okay, have this synovial joint system. But sometimes, as I said, with crimping, with all the weird things that rock climbers do, it can get inflamed, okay? Inflammation is basically the body's way of recognizing that there's an injury, okay? So you can get swelling, okay? You sort of get swelling around this portion here and this portion here. And once it's swollen and it's inflamed and the body's recognized that there's little traumas and tears in the synovial membrane, the joint actually fills up with synovial fluid, and that's when essentially your mobility decreases. You start to get discomfort in your hands. Now, if at this point you're panicking and thinking, I've sort of got early onset of arthritis, I'm going to end up, sort of with curled hands and bony growths and things like that, don't panic. Of course, any inflammation of a joint is technically arthritis, but it's not rheumatoid arthritis and it's not osteoarthritis like you would associate in the elderly, which is quite debilitating. This is a temporary condition, okay? Now, of course, if you keep on getting it, you will end up with problems in whatever joint has been affected, and it will reduce your mobility. But synovitis is temporary, okay? And it's just a case of the body repairing this little membrane here, okay? How to treat it? Don't do anything with that finger. I know what you're thinking, that, if you just sort of go climbing for a little bit, maybe rest for 2 weeks, it'll be fine. But synovitis, unfortunately, does not heal quite as quickly as muscle, things like that. So you really need to rest. And if you are desperate on going climbing, then tape that middle finger joint up, this middle flange joint here, with tape. Now, actually surrounding the joint with tape won't do anything in itself, but it acts kind of a placebo. So when you're kind of hanging on the wall and things, you think, I can feel that tape, I can see the tape, I'll just immobilize that finger and just use these fingers here. And it's not a big deal. I mean, Tommy Caldwell doesn't even have an index finger on one of his hands, and he's one of the best climbers in the world. So, just keep it out of action for a while. And if it really is causing discomfort, you can take some anti-inflammatories like ibuprofen or things, but discuss that with your doctor. And remember, if this carries on for longer than a month, see a specialist, see a physician, and as always, take it easy. Thanks for watching. Hope you found this helpful, and check out obsessionclimbing.com for more videos like this.